Hi, I'm Steph. If you've never watched my channel before, welcome. This is PT to Go. I'm a physical therapist and I created this channel because I wanted to help more people help themselves. This is a place where you can learn it here and then take it with you wherever you go for whenever you need it. Today I want to help you understand where your back pain is coming from. At the end of this video today, you'll have learned some of the most common causes of low back pain, and I'll give you some tips and tricks on how you can treat it yourself. Those are some examples of some of the most common ways back injuries occur. It may not even be an incident, there may not be an injury, sometimes it's just wear and tear. It is one of the most common reasons that people come into the clinic for physical therapy. Today I'm going to discuss 4 of the most common causes of back pain. First is sprains and strains. Second is spinal nerve compression. Third is degenerative disc disease, or DDD. And fourth is SI joint dysfunction. Number 1, sprains and strains. So a sprain is an injury to the ligament which supports the spine and joints. Strain affects the muscle or tendon, and a tendon is what connects muscles to bones. So those occur most often from falls, car accidents, using poor body mechanics when you're lifting, as well as many other ways. Sprains and strains can be very painful and can really limit your movement. The best way to treat sprains and strains right away is to rest, relax, use ice for 10 to 15 minutes every day on and off in a comfortable position. Check out my video on how to improve lower back pain for those gentle exercises. Once pain has improved, you need to work on body mechanics and posture so that those muscles, tendons, ligaments are not getting strained or sprained more so. And then you need to work on your core strength and stability. Your core is made up of the abdominal and the back muscles combined, all the muscles around your midsection. Once your back is injured, scar tissue forms and that tissue is weaker. So it's really important and will be a lifelong endeavor to get and keep these muscles strong for as long as you can keep them that way. This is what will protect you from any re-injury to that area. Second most common cause of back pain is spinal nerve compression. Now, this can come from many different areas, and basically what happens is the spinal nerve root that's coming out of your vertebrae, coming out of your spine, gets trapped or pinched, and then it can become inflamed, which your brain perceives as pain, and so it's very painful. Again, there's many different things that can cause nerve impingement. Some common ones, which you can see in the picture here. Now this is a cervical vertebrae, but it's a great illustration with all of these on it. So you see a disc bulge or herniation. You can see a thickened ligament, and you can see bone spurs. So often with this, you'll feel symptoms down one or both of your legs. It may follow a pattern down the back of the leg, down the side, down the front of the leg, and that just indicates which nerve is being affected in your back. You may feel numbness and tingling. It may go all the way down to your foot at times. Again, that just indicates to us as therapists that something is going on with a nerve. So these issues can be a little bit tougher to treat. Obviously, bone spurs don't just go away by themselves, but if you can relieve the symptoms and relieve the inflammation that's going on around there, you can get back to some normalcy with your function of your back. If the problem is from a disc, if the impingement is from a disc, you want to focus on extension exercises. So basically, you want to start just laying on your tummy if there is a disc problem or you've got the issues going down your leg. It's something to at least start with. So lay on your tummy if you can. Work onto your elbows, work into that press up position where you're keeping your hips down, you're pressing your chest away, And then you can also do just standing back extensions. So with that, we want to see the symptoms come up out of your leg. They might get a little bit worse in your back before they get better, but as long as they're not getting worse down the leg or legs, then you're okay. You're moving in the right direction. And then if you're struggling on your own and you've tried these and the symptoms aren't getting better in the leg, still painful, still numb, tingling, or it's getting worse, definitely get in to see your doctor, see a physical therapist. And what us as therapists can do is we do traction for this. So having on a table, either on your tummy or on your back, and we're just basically pulling. We're pulling your spine apart. We're encouraging that disc to go back where it should be, and for some pressure to be taken off of that nerve so that your symptoms will get better and again come up out of your leg, and then eventually go away. No matter the cause of the nerve compression, you want to rest, relax, get the muscles to calm down, get the pain and inflammation down, and then start with just gentle stretching exercises, work up to the more advanced core strengthening, again, to keep everything in alignment and strong so that hopefully you don't have any issues in the future. And with all of these, it's a lifelong endeavor. Once you've had some kind of injury to your back, it's going to be more likely to happen again. Third most common cause of low back pain is degenerative disc disease, DDD. Now, this is an age-related issue. As we get older, our discs dehydrate and they lose height. This is why we get shorter as we grow older. And when the space is smaller, the passageway for the nerves gets narrowed. And the facet joints, which sit on either side of the vertebrae, the disc, work in conjunction with that disc. And so when that space is narrowed, the facet joints can start to lose their cushioning, and they don't move as well, which can cause pain and impingement of the nerves. So for treating DDD, now this is part of growing old, so we can't stop it from happening. So the best treatment is to keep your back strong and mobile and healthy as long as you can. So you want to find those exercises, find those routines that include both strengthening and stretching. If you have DDD, keep moving. Modify activities, avoid heavy lifting, avoid any high impact activities. Give swimming a try. In the water, your joints are unweighted, and so there's less impact on that spine, less impact on the joints, and so less chance of getting that impingement and that pain from that. All right, last but not least, we have SI joint dysfunction. This is a very, very common problem. I see it often in the clinic. It's often misdiagnosed by referral sources. I think just because patients present with just back pain, their back hurts, but often it's more on one side. I am planning to do a whole video on SI dysfunctions because it could take a whole video, and it's one of my favorite things to treat because it's such a quick response usually, and easily corrected. So I'll kind of give you some tips on how to self-correct in that video. So here's a picture of your pelvis. These here are the SI joints from the front view. At the back, they would be where your butt dimples are if you have them. The pain with this is often in the low back, but more on one side. And sometimes it can travel down the back of the leg, the side of the hip, around to the front of the hip. Sometimes it can travel to the other side, it can start on one side and then travel to the other. That does happen. So again, generally with this, you want to begin with those gentle exercises, get everything back in alignment, avoid twisting, avoid leg crossing. If you're sleeping on your side, use a pillow between your knees so you maintain that alignment of the pelvis and the femur at the hips. So just finding positions that are comfortable when you do have that pain to relax it. So laying on your back with your legs up, using that ice condition can sometimes correct itself. So for all of these issues, I would, if it's acute pain, start with just gentle exercises, get everything calmed down, get the pain and inflammation out of there, give yourself a few days so you can pinpoint maybe where exactly that pain is coming from so you can better know how to treat it. If you're having trouble, it's not getting better, it's just lingering, don't let it go. Find a physical therapist. And just to recap, if it's a disc problem, focus on extension. If you're having those symptoms down the leg, numbness, tingling, focus on extension. You're trying to get that disc back in place to relieve the pressure on the nerve. Do not continue exercises. Don't continue the extension or any other exercises if your symptoms are getting worse into the leg. Definitely seek out medical help if you're feeling any of that. With degenerative disc disease, it's a product of growing older, which is one of the benefits of life if we get the opportunity. So find activities that don't aggravate the pain, but allow you to keep moving and stay active and strong as long as you can. For SI dysfunctions, it's a very common and often missed diagnosis, but it's easily treated. So stay tuned for a video dedicated just to this topic. Okay, so that's a lot of information. I tried to condense it as best I could so that this didn't get too long. I hope it was helpful. I hope it helps you pinpoint where your pain might be coming from. And more than anything, I hope it helps you get rid of your back pain, because nobody should have to live with back pain. If this video was helpful, please let me know, subscribe, share with your family and friends, hit the like button, and we'll see you next time.